at that point.
Not quite.
They usually push it in another inch or two after the urine starts coming out,
Okay.
just to make sure it's fully in the bladder and won't slip out.
Gotcha.
And then they secure the catheter to the patient's thigh using a strap or a device
Okay.
to keep it from moving around.
Causing discomfort or anything.
Exactly.
Okay.
And finally, the catheter is connected to a drainage bag,
Huh?
and the patient is monitored for any signs of discomfort or complications.
Okay, that's a really good understanding of what's involved for men.
Right.
Now let's talk about female patients.
Okay.
Because the sources are saying there are some pretty big anatomical differences right from the start.
Absolutely.
Yeah.
The most notable difference is the length of the female urethra,
Right.
which is much shorter,
Okay.
only about 1 to 2 inches long.
Wow. Okay, so that's a big difference.
Yeah, huge difference.
And it's also located just above the vaginal opening.
Right.
So does all this make the insertion process easier?
In some ways, yes.
Okay.
It's often more straightforward than for men. But, you know, every patient's anatomy is different,
Right, of course.
so it's not always a simple procedure.
So how does the prep for a female patient differ from what we just talked about for males?
The initial steps are the same.
Okay.
Hand washing and sterile gloves.
Yeah.
Positioning is key,
Right.
but a little different.
Okay.
Women usually lie on their back with their knees bent and legs apart,
Mm-hmm.
which is sometimes called the dorsal lithotomy position
Okay.
or frog leg position.
Okay.
And just like with males, they clean the genital area with antiseptic.
Right, to prevent infection.
Exactly.
Okay, so now the actual insertion, how is that different for women?
The tip of the catheter is lubricated,
Okay.
just like in the male procedure.
Right.
But here, the big difference is that they need to actually see the urethral opening.
Okay.
So the person doing it will gently spread the labia,
Mhm.
which are the folds of skin around the vagina,
Right.
to clearly identify the urethral meatus.
Gotcha.
Then they carefully insert the lubricated catheter into this opening towards the bladder.
And do they still need to apply pressure to get past the sphincter?
Sometimes they do,
Okay.
but often it's a more direct and less resistive path than in males.
Okay.
And just like with the male procedure, the flow of urine tells them that the catheter is in the bladder.
Okay, so same sign.
Exactly.
Easy to know.
Yep.
So what about after the catheter is in place?
Once the urine's flowing, they push the catheter in a little bit further
Okay.
to make sure it's well positioned in the bladder.
Right.
Then they secure it to the patient's thigh so it doesn't move around,
Mm-hmm.
connect it to the drainage bag,
Okay.
and make sure it's working right.
Okay.
And again, they monitor the patient for any signs of discomfort or complications.
Just like with the male patient.
Exactly.
Okay, so we've walked through both.
Right.
Let's pin down the key differences side by side.
Yeah.
What are the must-know things about male versus female urinary catheterization?
Well, the big one is the anatomical difference. The male urethra is so much longer and more curved compared to the female urethra,
Right.
which is short and relatively straight.
Yeah.
And this really impacts how the procedure is done
Right.
and how likely they are to encounter resistance.
Yeah. Makes sense.
This anatomical variation also dictates how they position the patient.
Right.
Like for males, they need to manipulate the penis to straighten out the urethra
Right.
so the catheter can pass through more smoothly.
Yeah.
Whereas for females, they separate the labia to see the urethral opening.
Okay.
You see, it's all about access.
Makes sense.
Right.
And the source material is pretty clear about the ease of insertion being different between the sexes.
Absolutely.
Yeah.
Generally speaking, it's easier for females.
Because of that shorter route.
Right.
But it mentions that visualizing the urethral opening can still be tricky.
Yes, it can be.
Yeah.
Especially depending on the individual's anatomy.
Interestingly, it also says that the size of the catheters themselves are often similar
They are.
for men and women.
Although, of course, healthcare providers will pick a size that's right for the patient.
Of course, they
But,
wouldn't use the same one for everyone.
So beyond the steps of the procedures themselves,
Yeah.
what are the big considerations and complications that are relevant to both male and female catheterization?
Well, infection is a huge one.
Yeah.
Specifically UTIs,
Yeah,
urinary tract infections.
of course.
This is a big risk for everyone getting this procedure.
Regardless of sex.
Exactly.
So that's why they're so careful about sterile technique.
Exactly.
Yeah.
Critical. And discomfort is another potential issue.
Yes.
Even though they try to minimize the pain, some people might experience discomfort during the insertion,
Right.
especially if it's not done gently or if they have sensitive anatomy.
Yeah.
Now, trauma to the urethra or the bladder is more serious,
Right.
but thankfully less common.
Watch this coming.
And that can happen if the catheter is inserted wrong or too forcefully.
Right.
And then finally, for catheters that stay in for a while, there's the possibility of what they call catheter-associated issues, like bladder spasms, urine leakage around the catheter, or even a blockage of the catheter itself.
Right.
So those are all really important things to watch out for.
They are.
Yeah.
And speaking of different types of catheters,
Right.
the material you sent
Yeah.
gives us a nice overview of the different types.
Can you give us a quick rundown of those?
Sure.
Yeah.
So there are indwelling catheters,
Mm-hmm.
also known as Foley catheters.
Okay.
These are designed to stay in place for a longer time,
Okay.
and they have a tiny balloon at the tip
Oh, wow.
that's inflated with sterile water once it's inside the bladder.
And that holds it in place.
It does.
Wow. Okay, that's
It
interesting.
prevents it from slipping out.
Gotcha.
Then there are intermittent catheters,
Mm-hmm.
sometimes called straight catheters,
Okay.
and these are for short-term drainage.
Okay.
So they put it in, empty the bladder, and then take it right back out.
And those are the ones people use for self-catheterization.
Often, yes.
Okay.
And lastly, there are suprapubic catheters,
Mm-hmm.
which are long-term catheters
Okay.
that are inserted directly into the bladder
Okay.
through the abdomen.
Oh.
So they bypass the urethra completely.
So they're not going through the urethra at all, and
Yeah.
that's for cases where the other types aren't feasible.
Actually,
Okay.
usually for long-term management,
Gotcha.
you know,
Okay, so we've covered so much.
we have.
What are the absolute key takeaways about urinary catheterization?
The main takeaway is that even though the goal of this procedure is the same.
Right, to drain the bladder.
Yeah.
Yeah.
The actual steps and considerations
Mm-hmm.
are very different for men and women.
Right.
And that's mainly because of the anatomical differences in the urethra.
So it's not a one-size-fits-all procedure.
Definitely not.
And of course, we have to remember the risks like infection,
Of course.
and that using sterile technique is so important to minimize those complications.
For all patients.
Yeah, that's a really clear summary.
Good.
And here's a thought I had for our listener.
Okay.
You know, we see how precisely this procedure, which seems pretty straightforward, needs to be adapted to each person's anatomy.
Right.
It really makes you appreciate the complexity of the human body and the skill required in healthcare.
Absolutely.
These professionals need to know so much.
They do.
And it makes you think about how much work goes into medical innovation to constantly refine these procedures to make them safer, more effective, more comfortable.
Right. For everyone who needs them.
Right, exactly.
It's fascinating how medicine is constantly evolving.
Yeah, even these common procedures are always being reevaluated and improved
Absolutely.
to make things better for the patients.
Yeah. And it's not just about making the procedure work.
Right.
It's about the whole patient experience.
Right.
Making it as comfortable and stress-free as possible.
That's a really great point.
Yeah.
Well, thank you so much for walking us through all of that.
My pleasure.
And thank you to our listener for bringing this to our attention.
Yes, thank you.
We hope this deep dive gave you a good understanding of everything about urinary catheterization.
I hope so too.
And we'll see you next time.
See you later.
Bye.